let's talk about what success looks like, right? Because most of the time people come into my office and they want no pain, right? That's their goal, is no pain. And okay, that's a good goal. I don't even hate that goal. But you're not going to be pain-free 100% of the time because you're alive and you're not 20. But that's only one metric of what success looks like, right? Sometimes success looks like improving mobility and range of motion. Sometimes success looks like improving your strength. Sometimes success looks like improving your endurance or your walking tolerance or your working tolerance or your lifting tolerance or whatever functional activity. So I like to think of goal setting and progress as a graph that has 10 different lines on it. And some of those lines are improving, right? So maybe your range of motion is skyrocketing, it's getting so much better, but your pain level is actually increasing. That's one of those is great, one of those is not good. So we have to weigh, we have to figure out, whether our treatment strategy is right or not. But just because your pain is getting worse doesn't mean you are necessarily worse, right? If your pain is worse, but you walked 3 times as much as you did previously, okay, one of those metrics is much better. One of those metrics is worse. And then we have to start kind of doing the mental gymnastics of how would that walk that was 3 times as far as you could on day 1, how would that have felt, right? Would you have been a total train wreck and your pain would have been way out of control, and now it just it bumped up to significant, so again, we have to put our expectations along a lot of different lines.